Hello, my name is Jan Mold. I'm one of the Assistant Directors for Competitive Events for HOSA-Future Health Professionals, and it's my pleasure to talk with you today about communication. I know that you are good communicators and that you communicate really well with each other, but that always doesn't work out quite as well as we'd like. I want to share a quick video with you.
Hi, HRU.
What?
WC. QQ. WOYT.
I have no idea what you're talking about.
ROTFLOL. JK. FDOJ. What you got?
Oh, tuna and coffee.
GGMSOT. $5.95. Hi, MIHU.
What?
YGTBKM. WOYT.
I have no idea what you're saying.
What you got there?
Oh, I've got 3 burgers, fries, chocolate shake, and ice cream.
Well, IMHO, that's just TMF. I mean, OMG. $11.95. TY.
May I have a word with you for a moment, Lydia?
NP.
Lydia, you've got to stop speaking in text. The customers don't know what you're saying, and they've been complaining. I mean, do you always talk like this?
IDK.
What?
I mean, I don't know. Maybe I do. UTITM? You think it's too much?
Yeah, I do. Okay, communication skills are essential for this job, for any job. It's the top of the must-have list for every employer. And I'm your employer. Did I make myself clear?
Yes, ma'am.
Okay, good.
Hi, HRU. I'm sorry. May I help you?
Yes, I have a chef's salad.
Good communication skills are important for everyone. You need skills for both communicating information to others and receiving information from others. If you and your employer communicate well with each other, you'll have a much better chance of keeping your job and maybe even getting a promotion. To find out more, just log on to the website.
Okay, and I know that's a little exaggerated, but I think at times it's really important for us to think about how others perceive us and how our communication may be a problem if we're not being perfectly clear. Communication comes from the Latin word communicare, which means to share or to make common. So if we're making something common, that means that we're both going to understand what's being said and we can impart or exchange information. So I want you to think of some appropriate terms that you use that your parents might not understand. And I'll give you an example of what I'm going to be discussing or what I want you to be jotting down. And that is a concept like talking. Now, I'm older, I understand that, but talking to me means something totally different than it did to my students last year. And I've never quite got the hang of what people were talking actually meant. So I'm going to give you just a minute to think of some terms that you might say at home that your parents might not understand exactly what you mean. Okay, time's up. I've had you do that just so that you could start thinking about how it may be that people that aren't your age may not be following exactly what you say or getting the meaning that you want them to have. So just want to really stress to you, like the video did, how important communication is. The communication process itself starts with a sender, which moves with the message. It has to be encoded. You need a channel, a receiver, decoded, and feedback. We're going to go through each of these steps in the communication process to help you just become more aware of what goes into actually completing the communication. The sender is the person who has the idea of thought, it's what they want to share. So that's going to come from somebody. It then becomes a message, what you're wanting to pass on to the person. When we say it's encoded, that means that that's how we're going to share it or how we package it. It can be verbal, like I'm speaking to you now, or like you are when you're on the telephone. It can be nonverbal. That means no words are used. And I'm going to give you an example that I think probably all of you can identify with. I can pick on mothers because I am one, but I talk about the mother's look. You know, when you're at the line and mom's had enough, that look she gives you, she doesn't have to say a word. That is the best example I can think of nonverbal communication. And for a lot of us, we use both, the verbal and nonverbal together. Channels, if you think about your senses, are the way that we're going to send that message and how it's going to get from one person to another. It may be seeing, it may be hearing, or it may be feeling. The receiver is the person that's going to get the idea. The decode is kind of unwrapping that package of how it was sent and making it have meaning to you. And then feedback is the response that's sent back to the sender from the receiver. So our process, the sender, the message, the encode, the channel, the receiver, the decode, the feedback, we need all of those to be clear for the communication process to actually occur and be successful. Now, there are some barriers that can occur in the communication process. And we're going to talk about a few of those. And as we're talking, I want you to think about how you could overcome those barriers in a healthcare setting. Use of jargon. It's unfamiliar. I don't speak text. Never have been able to. Don't know enough to speak text. Unfamiliar terms, think about healthcare providers. Have you ever gone to see a healthcare provider and they've talked and you didn't understand their language? Because healthcare has its own language. And sometimes as a patient, you need to say, I'm not understanding what you're talking about. Because it may be too technical for me to catch on. There may be emotional barriers. There are some things in our society that are taboo to talk about. We're not comfortable talking about them. And so we're going to put up that barrier anytime those topics come up. Distraction, being uninterested, a lack of attention. It's easy to get sidetracked. And again, I can pick on moms since I am one, but moms can get really distracted. She comes in from work, you got something really big you want to tell her. She's trying to do 3 things as she's getting supper ready. You're giving her as much communication as you can, and she, and you know that she is too distracted for a good communication process to occur. Difference in viewpoint. We all come from different angles. We've all had different experiences. Sometimes we've got to really think about things through the eye of the receiver if we're the one sending the message. Physical and cognitive issues. Some of these are inherent in healthcare. You're going to run into them. Hearing loss, visual impairment, speech impairment, intellectual abilities, and age. And I want to talk for just a few minutes on each of these. For hearing loss, it's going to be really important that you're facing your patient. You are not covering your mouth, because a lot of your patients who have hearing impairments or hearing loss are going to read your lips. You need to speak in a loud voice, not screaming at the patient, but making sure that you are loud enough that they can hear you. For visual impairments, you don't want to sneak up on these people. You need to announce your presence. You need to explain what's going on. If they're visually impaired and they're not able to see, they need to know. For your speech impaired patient, you need to let them try to speak. And then you're going to do something that's called reflection in what I heard you say was, and then repeat, just to make sure that you've got the message that they meant for you to have. Intellectual abilities, again, that could go on with jargon. You're going to have to assess your patient. If I were having a pediatric patient in my practice, I would be very careful about how I explain something. If I were going to explain that they were having their blood pressure measured, and the cuff and the stethoscope might seem a little intimidating to them, I would explain to them that I was going to use the cuff to give them a little hug. It's going to be tight for a second, but then the hug's going to let go. So you need to really focus on intellectual abilities and age as you try to explain procedures to patients. All of these can be overcome. It's just being aware of it and making that effort. Language barriers. The Center for Immigration Studies estimated in 2018 67.3 million in the U.S. spoke a language other than English at home. So you may have somebody who struggles a little bit in the communication with you. And here's an example of that. There was a healthcare team that misunderstood an 18-year-old's family who said that he was intoxicado. Now, when we use that word, when I read that word, I'm sure some of you had some thoughts about what it meant. The interpreter misunderstood the term to mean intoxicated. The family meant he had ingested something. To them, it might have been that he had bad food, but the misinterpretation by the interpreter really caused some significant problems. As a result, the patient was treated for a drug overdose for 36 hours before it was realized that he had a brain aneurysm. An aneurysm is a weakening of blood vessels that basically explodes. This particular patient ended up being a quadriplegic, and his family was awarded $71 million in a malpractice settlement. Terrible error. Again, miscommunication. Cultural differences. Webster defines culture as the beliefs, customs, and arts of a specific society or group of people. And I have a short story that I have read to my students when we talk about cultural that I wanted to share with you. Travel with me. I hope all of you like to travel. Today we are going to the island of Crete, Greece. The clear blue waters of the Mediterranean are a beautiful sight. We are peeking in at a young couple who have visited these beaches many times, but our journey is a little different this day. Today they are in a Greek hospital, anxiously awaiting the birth of their first child. They are alone, and with the exception of the physician, no one else speaks English. The couple have been sweethearts since junior high and are in this wonderful setting, compliments of Uncle Sam and the United States Air Force. The young man is clean shaven, again thanks to the Air Force. The young lady has been to nursing school and cannot help but focus on all that could go wrong during labor and childbirth. With no one there to support them, their anxiety is high. Their anxiety only increases as they note that the Greek families gather in mass. Imagine a family reunion. Aunts, uncles, cousins, everybody's there. Also, in Crete, the louder the female verbalizes their pain, the more feminine they are considered. And those around them are definitely expressing their femininity with screams and shaking at the bed rails. A nurse comes in to provide care. Hello and thank you are exchanged, but that's about it. Questions on the young couple's mind go unanswered. The weight seems unbearable. Finally, after 21 hours of labor, a healthy baby boy is born and named after his father and grandfather. He is sent home with a birth certificate his parents can't even translate. You see, I, Jan Mold, know a little bit about cultural diversity in healthcare. I'm half of that young couple, and am proud to report that that infant is now 38 years old. Having my first child in a foreign country was invaluable to me as a nurse. I learned that care and concern go beyond words. I also learned that just because things are done differently, outcomes are not necessarily altered. We are very much where we've been and what we've learned from our families and our own culture. And not everybody does it your way. And it takes some open-mindedness to learn the cultural differences. And what we're striving for is cultural competency. And first thing you need to do is increase your knowledge base. One of the things I did when I knew that I was going to have my baby in Greece was I needed to learn about how they did things and how different it was going to be. You need to make sure you have open lines of communication with your patient. Patients can teach you a lot. You just have to be willing to ask and let them know that you want to learn more. And then any experiences you have with others from a different culture is going to be very beneficial to you. The bottom line in communication, and the most important part to me, is treating each person with respect who has a right to quality care. Every individual you come in contact with needs your respect and deserves your respect. I have about 3 assignments. Your teacher can decide whether to use any or all, but I wanted to go over those with you. There is at HOSA.org, under Competitive Events, under Health Science Event, there is a Cultural Diversity and Disparities in Healthcare. What you'll do in this activity is you'll be divided in teams and you'll develop a PowerPoint to share with your class on religion, rituals, or health and illness for one of the following. And there are 5 listed there. And those are pulled directly from the guidelines. So if you do these, listen to your classmates present their PowerPoints, then you will be ahead of the game in preparing for this written test. Assignment number 2 is to use the prepared speaking guidelines to develop a speech. And each year, the prepared speaking is on the HOSA theme. And this year's HOSA theme is Unlock Your Potential. Most people are most afraid of speaking in public. This is a great opportunity for you to get some practice. Every time you do it, it gets a little bit easier. And then the final assignment is to use the creative problem-solving guidelines. You'll be in groups, and the particular assignment that I'm including here is that you're part of a community group that's to implement changes to assist the local health department who's seeing increasing numbers of patients who do not speak English. You're going to describe the policies, activities, or program that your team would implement to address the concern regarding this issue and to help those that seek care at the health department. Thank you for your time. Happy communicating. It's really important in a healthcare setting.